Welcome to Lecture 4 of Unit 3, where we continue the discussion on government spending and look at the drivers of expenditure. This lecture reviews the factors that can drive government expenditure. While this is a cursory overview of possible drivers, it is worthwhile noting that these factors can be used to quantify the key parameters of a policy and used as key performance indicators to monitor and evaluate performance. Such parameters, again, in fairly general terms, will be used to determine budget estimates in the later units that discuss the budget process. That is in Unit 6 and 7, but predominantly in the last few lectures of Unit 7. Expenditure is driven differently depending upon the benefits or the package promised and the manner in which the benefits are to be provided. Essentially, political processes should interpret society's social preferences based on their values, which includes all aspects of a program. That is, what is to be provided, the quality of what is to be provided, and how it is to be provided. And all those three elements, when seen together, can be divided into supply and demand aspects of the design of the program, which, when you break down under each of those features the design of the policy, that are subject that involve a number of different drivers of cost of the service and are important to the determination of overall expenditure. So let's look, for example, at the public health care budgets. So if we break it down between supply and demand features, under supply we've got, for instance, the service mix. That would be important. That is your bed by type to population. So is it a cardiothoracic bed? Is it a surgical bed? Is it a general bed? Is it a day bed? Is it an inpatient bed? Is it a critical care bed? That mix has a very important cost element, and you will design it in relation to population, and that will give you a cost structure. But you've still got to determine what costs go into a bed, and that means that you've got to look at your sort of staff to bed ratios, for instance, noting that staffing doesn't always move with demand. It's a supply feature. You can fix the staff to the bed ratios, but if demand goes above that, then your staff might be overwhelmed. But you will still have an implied staff to bed ratio, and theoretically you'll be adjusting the number of beds to population to make sure that your staff ratios are ultimately consistent with the consistently related to population. You've got your standard treatment approaches, protocols. You can have you've got to look at your spatial access to served populations, which is how you've distributed the number of beds geographically and the number of facilities and hospitals. Your prices of inputs are important, such as staff, medicines, consumables, pathology, tests, assets, and asset maintenance. Although these will move largely with demand, but you will try and fix your prices up front as far as possible. Infrastructure will also be important. What infrastructure is in place? Your governance structure can affect the quality of what is delivered, but that's also a supply feature. You've got demand features, which is first and foremost your catchment population, which may exclude that population that might be served, for instance, by private providers where appropriate, but you'll modify your catchment population and weight it for the likely demand. Then you've got to take into account that population can change over time. You've got the possibility that there are cross-boundary and border flows of populations which can impact on the service. Changes in morbidity, which is how sick the population is, which will change demand over and above changes in the underlying number of people in a population. If we move on to basic education, the supply features have some similar notions. You've got the number of schools per population, you've got the number of classrooms and classroom size and population per classroom, curriculum design, service inputs, including your staff configuration to pupil ratios, your prices of inputs, namely staff, which you would want to fix up front, equipment requirements as well. On the demand side, you've got your population that is served, and you've got to take into account the changes in population over time through migration, immigration, natural growth, aging, getting younger. Your throughput rates, how many people are passing and failing, can affect your demand for a given population. If we look at cash grants, This is a very different kind of service to health or education. The supply features are much more centralized. You've got an administrative structure, but you might have to have local offices which are distributed geographically to closer to your target populations. You've got to have payment mechanisms as well. On the demand side, you've got your range of grants that by type, which might target child support, invalidity, old age, unemployment, etc. And then you've got your eligibility criteria, which affects demand, which is determined by means tests, age groups, contingencies protected against, etc. So all of those eligibility criteria affect demand. You've got take-up rates. So the efficiency of the administration may affect whether the population that is meant to take up the grants does, or whether or not more people take up the grants than should. And note that while the value of the grant might be fixed centrally, the demand for the grant cannot be determined by supply features alone. It will depend very much on the eligibility criteria and underlying need. So a cash grant is actually, its type of demand is referred to as a demand-driven budget. Let's look at another kind of department like human settlements, very different to the other ones we've discussed. On the supply side, you would have an administration. It might be affected by the number and scale of schemes that are operating. You've got the benefits that are offered, which might be social housing programs or particular subsidy programs that are in operation. The demand side will really be the take-up of some of those benefits that are on offer. You've got the number of projects that might be going on. You've got a cost per project, etc. Not so easy to determine upfront criteria because human settlements doesn't really work like a service department. Much will depend on the specific nature of any housing scheme. Let's look at a social health insurance scheme. Quite different to a public health scheme. On the supply side, you'll have administration, you'll have a governance structure, which will be important, but basically that's what you've got on your supply side. On the demand side, it will be affected by the benefits that you're promising, the population that is covered. So your benefit package might say, we're covering these hospital services, but we're not covering these outpatient services. So the benefit package won't be defined in the same way as a public health system, which defines the benefit package on the supply side, not on the demand side. Your claims risk of the population covered will be also important. What is the age and gender and morbidity of that population? What are the prices of services will impact on demand side costs? And you might not be able to control them in every instance because they might be under the control of private providers. And then there are healthcare provider incentives resulting from purchasing and procurement arrangements. So supplier-induced demand and so on could impose risks. If we look at spatial and infrastructural planning and implementation, it's not so easy with this kind of department either. On the one hand, you've got to have very strong policy-making structures for integrated research, planning, consultation, implementation, and coordination. They've got to have strong implementation platforms for project management, procurement, and consultation. You're going to have regulatory platforms. That's for land regulation, land use regulation, as well as transport systems. On the demand side, you might have the number and nature of projects. It's not driven in the same way as healthcare or basic education, as well as the requirements for infrastructure maintenance. So those give you a sort of very brief overview of how different certain drivers are between certain departments. I'm not expecting you to think of the different drivers as being the driver that you have to use, but to get a sort of a sense that this is the kind of information that is required to understand what is going to drive expenditure on this, and how it's understood between the sort of supply side features of a program and the demand side features of a program, because the demand and supply aspects of any kind of program are not equivalent, and demand is not always taken into account going forward coherently in the planning process of any department's budgets going forward. So some questions to ponder. Is it possible for government to lose control of expenditure? it will be useful to think where that would occur. Why would that occur? Is it a supply feature? Is it a demand feature? What factors must be taken into account when planning for a new or reformed program? And what should go into the annual planning process for a budget? Okay, and with that we end this lecture.